Introducing the aerFree Airway Management System, or AMS, to help maintain a patent airway in patients who may experience sedation-related airway compromise. aerFree is a whole new way of treating patients with airway compromise. aerFree AMS is a non-invasive, simple-to-use external airway. The system comes packaged with the aerFree AMS collar and vacuum tubing. Current airway support devices are invasive, require specialized training, and are time-consuming to use. The aerFree system can be quickly applied to protect a patient's airway by following a few simple steps. Connect to a vacuum source, adjust vacuum level, and place on the patient's neck. It's that easy. Sedation-related airway compromise is a common challenge and problem for medical professionals in multiple environments, including sedation procedures, post-anesthesia care units, ambulatory surgery centers, GI, radiology, imaging studies, and other settings where airway compromise is common. Commonly used sedatives can lead to upper airway compromise by reducing tone in airway muscles, similar to what occurs in sleep apnea patients. Current airway management tools and manual procedures, including endotracheal tubes, oral airways, nasal airways, LMAs, CPAP devices, and chin lifts, are difficult to use, time-consuming, and require specialized training for healthcare professionals. In addition, there is a higher level of risk in using these devices and manual procedures, and potential side effects such as laryngospasm, vomiting, and upper airway discomfort. Maintaining a patent airway is a major safety concern of clinicians and physicians in patients requiring sedation. Publications document frequent episodes of sedation-related respiratory distress. When respiratory status is monitored by pulse oximetry and capnography, respiratory compromise has been shown to be frequently associated with sedation analgesia. Frequent occurrence of upper airway dysfunction associated with sedation is a safety concern in clinical settings where an anesthesiologist may not routinely be available. In situations where airway compromise may be anticipated, compared to other alternatives, the aerFree AMS provides a quick, effective, non-invasive solution. A new solution to airway management is now available, called the aerFree AMS. It is the first and only FDA-cleared non-invasive external airway device. It is a simple-to-use, non-invasive means to hold the airway open using standard wall vacuum. aerFree operates on the principle of applying gentle vacuum to the outside of the upper airway using a soft, flexible collar, which facilitates airway opening by establishing a differential pressure gradient across the airway. This laryngoscopic video clearly depicts the effects of aerFree AMS on a patient's airway as vacuum is applied and then removed from the collar. The aerFree AMS is able to maintain an open upper airway without the need for invasive, time-consuming, and risky devices. The aerFree AMS has the benefits of being non-invasive, simple to use, is a disposable, single-use device, can be applied in seconds, requires minimal training, and can be effectively used by all levels of healthcare personnel. A clinical study has shown aerFree to be effective in reducing the number of apnea events and the number of subjects with an apnea event while under sedation. The aerFree system is simple and easy to apply and use on patients. Each unit includes the following: the aerFree AMS collar, which has several important features. A thin, protective liner to keep the adhesive gel free of contaminants. A soft, flexible, non-latex material to fit a variety of facial structures and neck sizes. A vacuum port, which will be connected to the vacuum source. A reference arrow embossed on the collar to indicate the top of the collar, which allows for proper positioning of the collar. A chin cup to help with proper placement of the collar. An adhesive on the inside of the collar that helps to secure the collar to the patient's skin. Each aerFree kit also comes packaged with vacuum tubing with color-coded ends. Setting up the aerFree AMS on patients is simple, and it only takes a matter of seconds to set it up and place it on the patient. Remove the aerFree AMS collar from its package, leaving the protective plastic liner in place. Attach the blue connector of the tubing to the vacuum regulator. Occlude the end of the white connector and adjust the vacuum regulator to -45 centimeters of water, or 33 millimeters of mercury. Note that when removing your finger from the end of the white connector, it is normal for the vacuum gauge to show a lower level of vacuum. Also note that the vacuum tubing must be occluded to accurately set operating vacuum. Reminder: if the tubing is not completely occluded while adjusting the vacuum regulator, an inaccurate level of vacuum may result. Attach the white tubing connector to the collar port, making sure it is securely inserted. When placing the aerFree AMS on a patient, the patient should be supine, with the head in a neutral position. Prep the patient's skin using one or more alcohol wipes, wiping the area where the collar will be applied approximately 1 inch above the mandible to 3 inches below on the neck, and from earlobe to earlobe. The skin should be dry prior to placing the collar. Remember to make sure the vacuum is turned on and set to -45 centimeters of water. With the protective liner removed, orient the collar with the arrow pointed up toward the patient's nose. The first point of contact should be positioning the patient's chin in the chin cup. Holding the ends of the collar, rotate the collar until the lower flange contacts the patient's neck, at or below the thyroid notch. Then allow the ends of the collar to contact the patient's neck just below the ears to create an airtight seal. If the lower flange contacts the patient's neck above the thyroid notch, the collar should be repositioned slightly lower on the patient's chin. Ensure that the flange is not folded over on itself and that it is in contact with the patient's skin along the entire flange. Also, ensure that the flange is not touching the patient's ears. The upper edge of the flange should be as close to parallel with the mandible as possible. Verify that the vacuum gauge rises to -45 centimeters of water, or 33 millimeters of mercury. The vacuum should securely pull the collar into place if properly sealed. If the vacuum gauge reading is at -45 and the collar properly in place, the system is now functioning to hold open the patient's airway. If a patient is repositioned while using aerFree, verify that the vacuum gauge continues to read -45 and that the collar is not dislodged. At the end of the procedure, after the patient is no longer at risk of airway collapse, the collar may be removed by simply lifting up one edge of the flange and peeling the rest of the collar off. The collar should be discarded in accordance with your facility's policies. The aerFree AMS is to be used as an aid for maintaining the patency of the upper airway in spontaneously breathing adults undergoing medical procedures less than 2 hours in duration, where the patient is intended to have mild to moderate sedation with non-propofol-containing medications. The aerFree AMS is contraindicated in patients with the following conditions. Exclude patients with cutaneous hypersensitivity to silicone rubber materials. aerFree AMS is a simple-to-use, non-invasive device that effectively and safely reduces the occurrence of upper airway obstruction during sedation.